There's this pattern where if a teenage girl says, I feel really anxious, because of culturally how we're talking about it right now, it's straight to sort of that psychology road. And so right at a time where they actually need way more iron than ever before, they've dropped their iron by going purely plant-based. Anxiety can be a symptom that arises, and I want to shout that from the rooftops.
You have written a new book about iron, and I'm really excited to dive into that because I think we are confused. There are so many people I think we're having more transfusions than we've ever had. Let's talk about why that is. But I really want to understand, because I really like your story as to why you wrote this book or how it came about. So can you share a little bit about that?
Thank you so much. Yes, so I actually started down the path writing a completely different book. It was actually going to be about perimenopause, and I was 65,000 words into that when I sat back and realised all I wanted to talk about was iron. The first 11,000 words were about iron. So I decided to go back and just focus on that. So it was a big deep dive rabbit hole, research focus on that for 18 months to bring it to life, because I feel like there are so many cooler nutrients. Everyone's very focused on things like magnesium and vitamin D, and that's great and they're really important, but iron's being forgotten, and it is the most common nutritional deficiency in the world. Obviously, it's very common amongst women across the menstruation years, pregnant women, and athletes, and it's also sadly really common now for little children.
See, I don't see kids. So, and any time someone says, can you see my child, I'll be like, no. But I refer them to the right people. I just really struggle treating kids. So I actually wasn't aware of that.
Yeah, they're not eating enough iron-rich foods for a start. And I think a lot of people aren't aware that once around 6 months, the fetal endowment has all run out. And so iron-rich foods need to be introduced when complementary foods are being given to little humans.
Is that why we've always traditionally used fortified rice cereal or whatever we used to get?
Yes, that's exactly right.
Right, that makes sense. And then we constipated our 6-month-old babies, the poor things. I always joke because I gave Olivia pumpkin as her first vegetable. Or food, one of her first foods, and I turned her orange. I gave her that much. Her skin colour changed.
How wonderful, though, that she had such a hearty appetite.
I know, but then I took her to whoever. I must have been taking her to the maternal child health nurse, and she took one look and she's like, does she look orange to you? And I'm like, yeah. I'm picking up what you're putting down, and it might have just been pumpkin for the last little while.
We live and learn.
I mean, we really do, that first poor child.
Yes.
Anyway,
yes.
So I guess you've kind of explained to me why iron. How did we get ourselves in this position though, do you think? Like, is it that we're not absorbing nutrients? Are we not eating enough? Like, how do we get here?
All those reasons. So firstly, lots of us don't eat enough iron. The RDI for iron across the menstruation years is 18 milligrams a day, which is quite significant. And I have seen a huge rise in iron deficiency in teenage girls. And just can we just do a little sidestep for a minute, Nat? It's something that really, really concerns me is that right now in our culture, the way we talk about anxiety is that we tend to go down a purely psychological or psychiatric road, and that is life-saving for lots of people. So I'm not taking away from that at all. But what we've forgotten is that anxiety is a symptom of iron deficiency. I'm not saying that everyone who has...
It really is, actually. When I was pregnant with Geordie, my ferritin stores were at 2. And I was like so anxious, palpitations, anxiety, felt like something was sitting on my chest. The minute a patient now says to me, oh, my chest, I'm like, that's iron.
There you go.
But it's an awful feeling. Awful. You can't explain it.
So right now I think there's this pattern where if a teenage girl says inside her home, I feel really anxious, because of culturally how we're talking about it right now, it's straight to sort of that psychology road. And my worry, and that might be the right road, but my worry is that something like iron deficiency can so easily be missed. And they're often at an age where they might be on social media and being influenced by people they admire who eat purely plant-based, for example, and they've just started to menstruate. And so right at a time where they actually need way more iron than ever before, they've dropped their iron by going purely plant-based, and anxiety can be a symptom that arises. And I want to shout that from the rooftops, and I want everyone to understand that so that we miss less of them. A study was published 2023 called The Psychiatric Manifestations of Iron Deficiency Anemia, And they talked about how not just anxiety, but low mood, ahedonia, people's inability to feel pleasure was hugely linked to iron deficiency, and addressing it made all the difference to those symptoms. So it's just a really good watch out, I think. Know your iron levels if you have lots of anxious feelings, and correct it if you find it.
Actually, it's the one thing that is just tested and tested and tested. Like
it is.
Every doctor is happy to test iron.
Yes.
Let them test it.
Yes.
And get those results. But then what happens is obviously people are then recommended iron in supplementation form. Is that the best thing for them to do at that point?
Again, sort of rounding back to your previous question, we've got to find out why they're deficient in the first place. So is it a lack of intake? So food first, can't beat. Supplements are brilliant, but they're not a substitute for a great way of eating. You can't live on rubbish and then just supplement your way out of that. So, and I know that concurs hugely with your philosophy as well. So let's get everything we possibly can from food. If we're not getting enough from food, that's where supplementation can be game-changing, obviously. So it can be a lack of intake, or the person might be deficient because they're not absorbing it properly, and there are lots of reasons for that. It might be undiagnosed celiac disease, they might have Helicobacter pylori, a parasite-type infection, or it could be obviously really significant blood loss, whether that's through menstruation, or it could be blood loss because they're training for something like an endurance-type thing. So there can be microscopic bleeds from the bladder or the bowel. Foot strike hemolysis. So finding out why someone's deficient, I think, is really key. And then obviously correcting that thing that's gone awry, I think is game-changing. But obviously supplementation can be really important, especially when needs are high.
It's the one thing that everybody does straight away, supplement, but probably not give any consideration to any of the other things that you're talking about, because it's just not usually what's discussed in an appointment with a doctor that's doing the testing. And
the supplements that are often recommended are synthetic. They're made in a lab. They can be really constipating. That's a really common side effect of iron supplementation. So people will say to me, I'd rather be iron deficient than constipated, so they don't take the supplements.
Yeah.
There's some groundbreaking research been done looking at ferritin iron extracted from organic peas, and that's non-constipating, highly bioavailable. It's got its own absorption mechanism, so that's a good one to look out for if you're looking for a supplement that's not constipating, ferritin iron.
Interesting. So what do people need to look at? Is the ferritin just as important as looking at their iron?
In the blood test?
Yeah, because often someone's ferritin might be low, but their iron levels are high.
That's where other nutrients come into consideration. So for great iron metabolism, we need copper, we need vitamin A, we need beta-carotene. So when we see that sort of picture in someone's blood work, sometimes it's because of them not having enough iron, but sometimes it's related to one of these other nutrients like copper or vitamin A. Sometimes they need all of those things. So ferritin obviously is iron storage, and the normal range in Australian pathology labs is for menstruating adult women is 20 to 220 micrograms per litre. And in my clinical experience, that bottom number is too low. When it's below 50, it's like you don't have a backup battery. So I encourage people to know what their ferritin is. I've had lots of women say over the years, my ferritin was 22, so I was told that was normal, and they can hardly keep their eyes open. So we want that ferritin minimum 50. I encourage people to get it a bit higher, 80 or 100, so that they've got a really robust backup battery, particularly if they're going through perimenopause where they might be bleeding more frequently or having heavier periods, for example. But it's not just ferritin we want to look at. Transferrin is another parameter in iron studies, and a good way to think about it is it's like a sign of iron hunger. So the normal range for adult women in Australia is 2 to 3.6. And once it goes above about 2.5, 2.6, I see that as the body seeking more iron. So it can be confusing if you see transferrin with an H beside it and you think, that's high. Yeah. So people think, I've got too much of that type of iron, but it's not. Transferrin's like a taxi that drives iron around, and when we make more taxis, we need to pick up more passengers. Obviously, the passengers are iron. So once that transferrin gets above about 2.6-ish, that's a good time to, and particularly if ferritin is below 50, that's your body saying some more iron would be really helpful for me right now.
And what about iron itself?
Yeah, so
in terms of levels, since we've mentioned the others.
Yeah, so that's usually a reflection of dietary intake and or supplementation. So that's your serum iron is how much iron is actually there and available in the blood. If transferrin is just normal and healthy and you've got high iron, low ferritin, it can be a copper problem. You're just not getting it into storage. And copper, we used to get some copper from our water because we all had copper pipes. Obviously, most of us have plastic pipes in our homes now, but there is copper in offal, it's in shellfish, it's in avocado, it's in dark chocolate. So we can get some copper from food. But if people have gut problems, they might not be absorbing it well, or if people they might have an eating disorder, they might just not eat enough food, not because they have an eating disorder, they just don't focus on food, they're busy, they have coffee for lunch, for example. They're the type of people who might not be getting enough copper going in.
We've talked about anxiety. We've talked about, I think we might have mentioned tiredness or burnout. Maybe we didn't actually say that. What are the most common signs that somebody might be low in iron?
So fatigue, Nat, is the first marker.
I think everyone can probably associate with that. And if they've had a history of low iron, they know when it's low again. They're like, I feel that way again.
And I think too, and I have no doubt you see this in your work, people put up with fatigue. They don't see it as feedback. They write it off to, I'm busy, I'm stressed, I handle a lot. But it's feedback from your earth suit saying, I need you to do something differently here. And so the way I encourage people to look at it is fatigue that's not resolved from a good quality sleep.
Right.
And if that persists, then it's worth investigating what's going on with your iron levels if that's the case. So fatigue definitely, and obviously that's because our red blood cells transport in the hemoglobin, transport iron, oxygen throughout the body, and iron is needed for that. And so that's why there's almost nothing in the body that's not affected by iron deficiency. And it's the red blood cells. This just blows my mind. And I say this because I think the more in tune we are with how miraculous our body is, the more likely we are to look after it, because I think we look after what we care about. Every second we make 2.5 million new red blood cells.
Amazing.
Every second.
Amazing.
And iron is needed for all of those.
Wow. Yeah.
Inside your body there's actually an iron pool, and what you eat contributes to that iron pool. But also red blood cells live for 120 days, and when they die, the iron inside them is still perfectly good. And so they donate that iron when they're dying, they donate it back to the iron pool so it can go wherever it needs to. And one of its jobs is to get back to the bone marrow to make those red blood cells.
What an amazing system we have. It knows what it's doing.
Doesn't it? We just sometimes have to
listen.
get ourselves out of the way so it can do what it needs to do. But yeah, so fatigue, brain fog, anxiety, as we talked about, heart palpitations. You might crave ice. That's another.
That was me in the pregnancies, both of them. That's how I knew. I just chewed ice the entire time. It's all I wanted.
A new one I've heard is some women will freeze nuts and they want the cold, crunchy nuts out of the freezer. So rather than just, I'll grab a handful of nuts out of the cupboard, it has to be cold and crunchy.
Crazy.
Yeah.
Yeah, I did both pregnancies, but I didn't feel deficient with Liv, but I definitely – both pregnancies, that's all I did was I'd crush ice and I'd have it with sparkling water and some type of cordial or something because, you're pregnant, so you do crazy things. It was also a while ago.
Love it.
Geordie's 14 nearly. That's the last pregnancy I had. It is interesting how your body serves up these little signs that we can be none the wiser about. What about hair loss?
Yeah.
Can that be associated with?
Absolutely. Thank you for raising that. Of course, it absolutely can. Obviously, hair loss can be caused by lots of different things, but iron deficiency is one of them. And one reason for that too is linked to the thyroid. So I think a lot of people are aware that for good thyroid function, we need iodine, selenium, but iron is another crucial nutrient. We literally need iron to be able to make thyroid hormones, and then we need iron to be able to convert inactive T4 into active T3. We need selenium for that as well. So a really common pattern I would see in clinical practice was someone with not necessarily a thyroid disease, but a tendency to that underperformance. So they're on their way to an underactive thyroid and really poor iron status. So low ferritin, high in normal transferrin, and the person usually was just not eating enough iron to actually meet their requirements. So and the hair was thinning and they were really tired. So really common pattern, and it's another reason why I think having copies of your blood tests is important. And when you notice changes like hair loss, don't just write them off to age or stress. Let's get to the heart of it because it's your body communicating. It doesn't have a voice. It gives us symptoms to let us know whether it's happy or not.
In Chinese medicine, we say that hair is an extension of blood. So then when there's blood loss, often there's hair loss, which we see that happen if there's even illness often. And then the other one, which I want to ask you about, is breastfeeding and pregnancy, because often breastfeeding mothers can be deficient. And again, in Chinese medicine, breast milk is an extension of blood as well.
Yes. Oh, isn't that beautiful? I just love that approach so much.
It's just logical, But so, I mean, I look at that and then I kind of bring it over to what we know physiologically that's happening, and it kind of translates. Well, it always translates.
Yes.
What about the pregnant woman or the breastfeeding woman? Do they need to be any more aware of anything, any more diligent? Because obviously nutrients is being used differently, or being used more so.
Yes, very much, Nat. So the RDI in pregnancy for iron is 27 milligrams per day. So it's significant, and it makes sense when you think you're creating an entire new blood supply for a brand new human. It's mind-boggling and magnificent. And so, the iron requirements are significant. So it's very common when blood volume doubles around 26 weeks of gestation for mum to become iron deficient then, the pregnant lady to become iron deficient then, if she isn't already. So really important to do blood work across pregnancy to prevent that or treat it if that's what's happening. If you can avoid it, you don't want to give birth in an iron deficient state because lots of different reasons. As the baby develops in the third trimester, the size of its liver is growing and it's accumulating iron in its own liver. And if a baby is born preterm, if it's born too prematurely, it hasn't had time to accumulate as much iron, and there's very little to no iron in breast milk. And that's because iron can feed bacterial growth. And so the bugs can take iron for their own use rather than provide it for our use. So the body in its wisdom doesn't pop. There's hardly any to no iron in breast milk for that reason. So when baby's first born, it has to rely on its own supply of iron that comes in that fetal endowment. So ideally don't give birth in an iron deficient state if you can help it, and be very mindful if baby was born prematurely. The paediatrician would guide a new mum with this, but iron might be needed in those first 6 months of life when essentially someone is breastfeeding or the baby's being bottle fed. And there won't be iron going in at that point. So it's so important to be aware of those differing requirements, and because it's such a special time and it's iron so needed for cognitive development. So much to do with the baby's growth is linked to iron.
So it's really important, I guess, to know where your iron status is pre-pregnancy if you can, and get that to be nice and robust. But what about the women that fall pregnant that weren't trying, or, these things happen. People find out after and then go, oh my goodness, now what do I do?
So go and have a blood, obviously as part of the blood workup when you first find out you are pregnant, know what your iron status is then and correct any insufficiency or deficiency you find, and then check it again later in the pregnancy as well to stay on top of it. So, we can't always, go into a pregnancy in the best state. If someone is planning to fall pregnant, then it is like all nutrients, but it is a really important one to focus on. And also between pregnancies. So when I was writing Fix Iron First, I went deep into the research about the time it takes to recover nutritionally between pregnancies. And again, it's not always possible, and it's not always what parents want. They might not want a big gap between children for their own personal reasons. I get that. But that's where supplementation is really important, because the literature, it wasn't clear, but it was leaning more towards about 36 months of recovery for the mother nutritionally. That was done without supplements though. Okay. So if a pregnancy was to happen closer together to recover mum nutritionally, then supplementation would be needed, I think.
And what about the woman that obviously is iron deficient and she's having multiple infusions? What do we do about that? How do we break that cycle?
So I think firstly, aren't we lucky to be living at a time with access to emergency medicine? And that's how I see an infusion. It's a great gift if you find out that it's through the floor and we need to get iron into that person really quickly. So it's a great gift. My worry is that people use it as the way they deal with their iron deficiency instead of trying to address whatever's going awry in them, whether it's lousy absorption or not eating enough, whatever it is. So, I meet women who they might have 4 iron infusions a year and they just don't worry about what they're eating, and that's a big problem. So that iron is just iron. It's in a huge dose and it goes straight into the blood. There's no copper, there's no vitamin A delivered with that. So they're all challenges. Iron, when it's free, can drive inflammation and oxidative stress. So some people will describe some really yucky symptoms.
Yeah, a lot of people get quite unwell.
Yeah. When they
can only do half the amount or we'll space it out.
Yeah. And it's for those, that's the inflammatory response, that oxidative stress, or it could be lousy copper, lousy vitamin A status as well. So because obviously they're just as important to healthy iron metabolism. So that's the worry. And I have, because I've been talking about iron since I wrote or reading about it and talking about it for, it feels like half my lifetime now, which I'm very happy about because I can't bear the unnecessary suffering that comes with it. Yeah, I've met lots of people. I ask people how they manage their iron requirements, and a lot of people do have that strategy to just use infusions, and it's a big worry. It's a big concern.
It's interesting too. I see a lot of women that will have a heavy period. And I'll say, well, we've just got to fix your period, and then your iron will actually come back up again, which is often not discussed because the tools, I guess, that we have are very different depending on the health provider that you're seeing.
Yes.
I find that fixing a heavy period is actually one of the easiest things that I do. Like it's like not that hard.
Yes.
I guess, yeah, it's such a big reason. I'm always like, well, why are you losing? Why is it low? Where are you losing it? It really does come down to poor absorption or not enough of it being eaten or losing it.
That's right.
Through blood loss.
That's right. And acupuncture and traditional Chinese medicine is one of the best ways to sort that.
Absolutely. And then also to that point, for the woman that's lost blood during childbirth, I will always be straight onto that one with blood tonics for that reason because that can affect her milk supply. That can affect how much hair she loses.
Her resilience, emotional resilience, I think is hugely tied to iron deficiency.
It is very interesting to me that we bypass the logic of all of this and go, that's okay, we'll just supplement. We'll just supplement. And to your point, a lot of people are taking fairly average supplements that are making them constipated and not feel great.
It's getting to the heart of why you're losing all of that blood. And do you know, Nat, I feel that and that's important across the menstruation years, and then it can be it can become a problem for the first time for some women through their perimenopause transition. And again, I guess it's a frustration of mine that it just gets blamed on perimenopause rather than you can get a heavy period at any time. You might get a heavy period when you're 16. That's not perimenopause. So it frustrates me that when we label it as perimenopause, it's not getting to the heart of why you have now started to lose more blood. Let's sort that out. And then, of course, as a response to sorting that out, you have better iron status.
Yeah. I mean, always looking at the root cause, I think, is something I just encourage people to keep asking why till you really get to the end of it. Like, but why? But why? But why? Be me as a 4-year-old. That's what I think is
great advice.
But, like you really got to get to that reason.
Yes.
And with iron, it's not too difficult, really. We're just not looking in the right places.
Agree.
Most of the time. We unpacked why so many women feel exhausted, anxious, or even flat, and how low iron might be at the root, even when tests say otherwise. Dr. Libby explained why iron infusions might not be the whole answer and how understanding your cycles and symptoms can change absolutely everything. In part 2, we go beyond the biology and we dive into the emotional drivers behind fatigue, stress, worthiness, and what it really means to slow down. Can't wait for you to join us.